One of the reasons we made progress is because of doctors and physicians. Our next speaker is Keyon Mitchell, Physicians for National Health Program and the California Health Professional Student Association.
Hi, thank you all for having me. I actually just got here about 30 seconds ago. So just in the nick of time, I guess. Happy birthday, Medicare. Dear Medicare, on July 30th, 1965, you were inked into law. You are much wiser and older than I am. You were surrounded by revolutionaries like the Voting Rights Act and the Immigration and Nationality Act of 1965. Your selflessness contributed to the desegregation of the South because hospitals who racially discriminated against their patients would not receive any federal funding granted to them in your name. You were a civil rights advocate lifting older Americans out of desperation when 1 in 3 adults over 65 years of age or older were in poverty. You are a legend like Cesar Chavez, Martin Luther King, and the legend who will grace this mic in a few moments, Dolores Huerta. Woo! There we go. We are facing difficult times now. We have to tweet phrases like Black Lives Matter as if we were transported back to the decade of your inception. And like the healthcare justice, our battle cry is loud and clear. Medicare, you deserve more. You deserve more than I can give you as a second-year medical student. Sometimes I get so frustrated with the limitations of our healthcare system, it begins to make me sick. Almost as sick as the patients who frequent our student-run clinics because although they might have insurance, it pales in comparison to you, Medicare. You do so much for our elders, yet you are not allowed to help the rest of us who are incessantly thirsting for more. You have not been allowed to reach your full potential. You are ripe with the sagacity and tenacity to lift us from the depths of our desperation as present and future healthcare practitioners who want to make sure we are all accounted for. Not just the ones who can afford to pay for their health insurance, not just the ones who attempt to navigate bronze, silver, gold, and platinum plans that fall into a hierarchical jigsaw puzzle that we call the healthcare system. But hold fast, Medicare. We are fighting for Medicare for all with and for you. Today we are with you, Medicare, and again on October 1st, Students for a National Health Program with students all over the country will hold teach-ins, candlelight vigils, and marches to highlight the thousands of people who die each year because they do not have health insurance. So you see, Medicare, you may be older, wiser, and have just a bit more patient experience, but just know that we are the new revolutionaries standing on the shoulders of giants like you. Thank you for all you have done, and we will not stop until we reach true health for all through Medicare for all. Thank you.